Sure.
Alrighty, Raj, over to you.
All right. I will get started by giving some introductions, and then I will keep on checking the chat box if somebody has questions, because I don't know if people are going to be talking, because I know everybody's muted their microphones, right?
Yeah, so anyone who joins in, their microphone will be muted. But if they want to ask a question, you guys are more than welcome to interrupt. Just unmute yourself and just ask questions, or you can just type in your questions on chat. If you guys aren't comfortable in like asking questions on an open chat, then you can send either me, Saurabh, or Raj a personal message on chat, so then we can just try to answer that question.
Yeah, absolutely. I can do that. All right, I'll start with a quick introduction. So I passed out of physiotherapy in 2010 from DY, and then I gave my GRE in the previous year, meaning in the fourth year. And sort of graduate. In 2000, so I gave the GRE in 2009 December, meaning when I was in my fourth year, when I started the fourth year, that's when I decided that I wanted to get into the business side of healthcare. And I got admissions starting in the month of March, and they went on to June. Schools start in the US generally in the second or the third week of August. And then I left, I think, on the 6th of August in 2010 to the US for doing a master's of science in healthcare management. So, mind you, I had not given the GMAT for the MBA. This was very interesting. But I did finish the MBA with the same B school because I transferred internally. So in 2010, I started the course for Masters of Science in Healthcare Management, and you could choose your minor subjects with it. You could choose marketing, you could choose data science, you could choose whatever you wanted. And then side by side, you could do a separate degree altogether. So I started the MBA with it just to have more options. So I did strategy and entrepreneurship with that. And then I finished both of them in around, I think, a year and a half. It is possible to do it in a year and a half. It's going to be a little intense, but you can. And then I did a 6-month or a 7-month internship after that. I worked at Baylor Health Care Systems. This is a healthcare chain of hospitals down in Dallas, Texas. They have around 50,000 employees and I think 35 or 40 hospitals that you could work at. I started working in the supply chain division, doing supply chain analytics, seeing what products are coming into the facility, what prices they're charging on them, because pacemakers and everything, sometimes they cost like $30,000-$40,000, just the pacemaker itself. But I was doing business analytics for them for new business acquisitions. They were thinking about starting another cardiac facility somewhere. So doing the whole paperwork on whether it makes sense to start it or no, whether it's going to be profitable, what kind of physicians should we have there in the first place, what services should we give, how many operation theaters should we have, those kind of things. And then I worked in supply chain and finance both for about 5 years, I think so. And then the whole H-1B fiasco as always comes up with somebody or the other happens, and I switched to working towards e-commerce in Boston in a company called Wayfair. It's somewhat like I think y'all have Pepperfry or Pepperfry, it's called back in India. I don't know what it is, but it's a furniture e-commerce company. And then I worked for them in supply chain for 3 years, and then in the spring of 2019, last year, I quit everything. And then I started traveling the world, and it's been 12 months plus now. Still jobless and still looking for something else. So yeah, that is my introduction. Now let me see. I can see something in the chat box. Oh, that's just Saurabh. Anybody has any questions per se? Because let's just make it into a question answer session, because I don't know what kind of questions people have. I don't know who is listening in and what year they are in, or what their doubts are, because this is more so like what questions you have versus what more I can give you information. Healthcare by itself in the US, as always, and maybe other people can tell you, is one of the largest industries in the US. When I say it's literally a whole industry, you can get into healthcare marketing, you can get into healthcare supply chain, healthcare finance, healthcare IT. Just put healthcare and put another second silo of whatever industry you can think, and it does kind of exist. There are people working in biomedical engineering. There are people working, I don't know, they're doing a bunch of stuff. Then I also have friends. Okay, so there's a question. Yeah, I will stop. Leaving career to travel. Oh, sort of favorite question. The answer to leaving your career to travel really comes down to the very basics of do what you love. You know, as dumb as it sounds when we grow up and people tell us like, how do you expect me to know what I like when I don't know what the hell I'm doing in my life? This was me always in the first year, second year, third year physiotherapy. I didn't know what shit I was doing till last year. Meaning sometimes I feel I wasted my time doing physical therapy. I wasted my time doing a master's. I wasted my time doing the second MBA. And then for what, right? Question comes up, why did I do all this in the first place? Because I didn't know what I really liked. Finally, I figured out last year what I really liked. And then at that point of time, I told myself, what do I see myself doing? Do I see myself sitting down on a desk for the next 10, 15 years in the US, keeping my H-1B alive and keeping the green card process alive? Or do I see myself unplugging from everything and just wanting to explore a little and travel and get out? And there were obviously, as you can expect, not a lot of people supporting this decision, right? Everybody would ask, are 20 days not enough in the year for you to get out and see the world? I was like, no. I said, you will not understand. I said, it's not about getting out. The fact that we generally, especially back in India, don't have the capability of saying, fuck it, I'm just going to take a backpack and travel the world. We don't do that normally. This is done by people back in Australia, Germany, most advanced nations, right? Where you have a place to go back to. Here I was just like, I'm going to unplug myself from everything that I know in the US, connections that I've built, people that I've known, literally everything. I even sold everything that I had and just took one tiny backpack. And I had 4 clothes, toiletries, one pair of shoe. And I told myself, you know what? You don't need a lot of things to be happy. You just have to be happy or learn to be happy around people. So that's what I did. Okay, let me check if there are more questions. Oh my God. Okay. Which country would you suggest to go for health economics specialization like HTA? Are Nordic countries a better option than North America? Okay, I do have a thing about Nordic countries. I was having a discussion with someone. Yes, you could go to Nordic countries for studying. I will tell you something that I didn't know before is the education system in Germany and in there is one more country I cannot remember, or there are a few more. Their fee structure. Okay, this is something very interesting. The fee structure in Germany, you could finish a master's course in maybe a few thousand euros or few thousand USD. But I'm saying this might be like below even the $10,000 range. I was very, very surprised that there were people actually finishing full master's courses and their semester fees used to be like 300 euros or 400 euros or something like that. Because the government subsidizes fees for everybody, and it doesn't matter who you are, whether you are international, national, you've come from whichever country, there is a rule of subsidizing fees. So when it comes to that portion, if money is a big concern, I would tell you to look at European countries. When it comes to job opportunities, everybody from even Europe is dying to come to either Canada or the United States. That is the biggest caveat when it comes to looking at North American countries versus Nordic countries for courses. For health administration per se, and this is one of the biggest, oh, did I do something? No. This is one of the biggest, let me just check this chat question again. HTA is, I don't know what is HTA. I'm guessing it's health something administration, health tech assessment. I don't know what that is. No, I have no idea what HTA is. But I was trying to say, in general, when you all read and hear about healthcare administration or people doing masters of sciences in healthcare management, you're wondering what the hell are they managing? Are they managing the whole hospital? Are they training you to manage the whole hospital? And this is what I learned. A lot of people didn't know what even healthcare administration meant in the first place. Healthcare administration didn't just, when you think in generic terms, when you're sitting back in India, healthcare administration means I'm going to be the administrator, like my dean, sitting and looking after things. And it's really not that simple. It is not that cut and dry. Healthcare administration by itself is an entire field where you could be either working, like I said, you could be doing IT, you could be doing coding, you could be working on health records, because US heavily relies on the electronic format of health records. So you could be, so I have friends currently working for companies that make softwares for the physicians to use to put in patient information. There is a company called Express Scripts. It's supposed to be really big. There's another one from P. It's called Practico something. I can't remember the name exactly now. But I'll tell you, I'll give you a job example. There is another company that makes a healthcare software that they want hospitals across the US to use. So sometimes your job is to go and sell that software to the board of directors of these hospitals. So you're basically selling a product. So when you see some people's designation, when they're senior product manager or senior program manager, is they're managing that particular product, which is a software made by some company, whether it is to improve billing in hospitals, whether it is to improve patient records, whether it is to improve the supply chain process. Now, since I used to work in supply chain, I will tell you there's a whole large section that just deals with healthcare supply chain. You're constantly trying to see what is more profitable, what is not, which company is making. Like take the current crisis, for example, right? 3M is making masks. They have asked Tesla to make ventilators and whatnot. So there's a whole different industry that deals with that. Okay, health technology assessment. But that's fine. I don't know particularly health technology assessment or what does it comprise or whether that's a master's program. I'm not sure. Saurabh is asking my other life questions. What's one? How old were you when you quit everything to be happy? Ha. That was around 3 or 4 years ago. So I was like, what, 27, 28. I had figured out that I'm in the wrong profession. I will tell you, I figured out I was in the wrong profession. It's funny, when I spoke to even Yardi way before this Unnati ma'am was the head of department. In my second or third year, I went and spoke to Yardi ma'am and I told her, I said, I'm not in the right profession. And she was like, yeah, I agree. You're not in the right profession. You should get into something that you really like. And by the third year, I had made a decision. Literally, by the third year, I had made a decision to get into healthcare administration. So the fourth year was all about finding schools, universities, programs, what's going to happen after that, how long are these programs, whether it's a 1.5 year program, it's a 2 year program, whether it is accredited by some universities in the US, what kind of job opportunities do I have? Could I tell you a little bit about the thought process behind deciding what you want to do and how the decision-making process evolved as you acquired more experiences? Oh, as I'll get to your question, let me just see the other one also. Is there a degree or knowledge help or hinder you in any way in the health admin field? Okay, I'm going to take that question first and I'll go back to OS. The straight answer to that is it does help to have a physiotherapy background, but there is nothing related to that background that you will need in your new job. Does that make sense? Because you're going to be learning subjects on marketing, on accounting, finance, quality management, bunch of other stuff. Nothing that is going to be related to what you studied in here. Did I plan to travel as a career too, or is plan on exploring other fields? Interesting. So I have been traveling not for the sake of traveling. A lot of people ask, why am I traveling? Right. The first question I get is, why the hell are you traveling in the first place? Are you traveling to find yourself? And I told people, I said, no. I found myself a while ago. How I found myself, again, that's a whole, it's a very personal question. Like one-on-one, when you go through your own ups and downs, this some way you're going to figure it out. Till then, you're always going to be questioning yourself. What to do all the time. I had to disassociate myself from a lot of the noise outside, I think, to ask that question of what really mattered to me at the end of the day, not what people wanted me to think or what people wanted me to do. Oh, my parents want me to sit down and be XYZ, or just because I finished 2 masters in healthcare management, I have to sit on my desk and be a health administrator for the rest of my life. I don't think that should be a compulsion in whichever way. Whether it doesn't matter whether you're back in India or here. I will give you examples of, I have friends back in Bombay right now who finished physical therapy, who run some of the largest nightclubs in Bombay. Yeah, think about that. I have another one who is working at she finished her MPA, master's in oh my god, what is it called? Public health, and she's working on the government side in smaller rural setups where she helps set up the polio camps and stuff like that. So she passed out from Tata Medical School, Tata, what is it called? Health Administration. I think there is yes, it's from TIS. There was another batchmate of mine, which I have not been able to be successfully in touch with, but he is now a professional dancer. So he liked to dance and he moved on the other side. People have started to doing Pilates. There's somebody else who started a wellness clinic somewhere in India. In Bombay, not even a wellness clinic. It's one of those wellness retreats that they're trying to invest in. So there are a lot of people doing a lot of different things. What I want to tell people is, don't get stuck with the aspect of, this is what I need to do and this is what I need to finish just because I finished 4 years of undergrad and this education will go waste, or what have I done and I've spent all this money and now I can't do anything else. I want people to move out of that thought process. If you think about it and go back as to what I want to do now, and all the money and the time that I've wasted in the last 10 years, I wouldn't have done it in another way, because all those parts of my life have helped me get where I am, whether that was physiotherapy, whether that was doing a master's that I don't use anymore. It didn't matter. All right, I'm going to check questions back again. Scope of healthcare administration in India. And I know I have to come back to your question always. Thought process and deciding what I want to do. I think there's a lot of scope for health administration back in India, if you ask me. Purely on the basis of aging population. The whole reason in the US people keep on talking about it, which is also going to happen back in India, is when the age of people starts to plateau, or when we have more disposable income back in India, right? More the disposable income and country grows and develops, the more problems you have. The more when I say problems, more healthcare problems you have. The more healthcare problems you have, the more hospitals you need, the more people you need for the administration aspect of it. So yes, there's a lot of scope back in India. If somebody is wondering, you could still do courses from whichever university back in India. I'm not well versed of how it works at the end of the day, meaning if you passed out from AIMS or you passed out from Tata, you passed out from somewhere else, what are the chances of getting a job? I don't know those particular details because, again, I have not worked back in India. But at least based on the number of hospitals I see coming up night and day everywhere, just because we have a large population, it's so basic, right? 1.5 billion people. So many people, so many hospitals, so many people required to manage it. I think it's really that simple. So those who not necessarily want to come, actually, that's a great point that somebody brought up. It's not just about trying to study outside. You could also study within India. But the fact is, ask yourself that question once again. Are you happy with what you are doing? I think that is the biggest takeaway that I can give you based off of my experiences on traveling or my experiences in life in general with physiotherapy. Without it was just trying to ask that question of, are you happy? And then I'll give you even details of how my decision was made more difficult, right? So both my parents are physicians back in India. They've been physicians since 50 years. My father still practices. We have contacts, right? When you say the favorite word, contacts within the healthcare industry. Contacts to a point that D.Y. Patil's daughter and my father are friends, right? Because they've been practicing since donkey's years now. And people ask that favorite question of, when you have these contacts and you have so many people that you know within the industry, your father has 2 clinics set within India. Why would you still choose to leave physiotherapy? Why would you choose to leave the medical field? Why would you choose to, why? Those are the favorite questions of why would you choose to do something different? Because I said at the end of the day, even when I spoke to my parents, they gave me the option. They said, do what you love. This is your life. It's not our life. And we are not telling you to live our life, right? So to choose what you want to do is extremely important to come to that decision point. When I made that decision, I was like, I want to go and study business. My parents were like, yeah, sure. If that is what makes you happy, then go do it. You don't have to continue being a physiotherapist just because you finished 5 years of studying physiotherapy. I think it was really that simple. And they've supported every decision that I've made, even till date. Even when it was, about traveling, I told them the same thing. I said, I know what I'm doing and I don't want to do what I'm doing. So they're like, if that is what makes you happy, then we are not going to stop you. You can go and travel, see the world, and make your own story, like make your own experiences and come up with a conclusion what you want to do for the rest of your life. Let's see if we have more questions. Can the knowledge and experience of studying or working healthcare systems in, say, the United States be generalized and transferred to working in healthcare systems in another country like India? Yep, great question. It definitely can be, yes. Healthcare administration. Oh, thank you, Sai. Really appreciate that. Sorry, I'll just get back to questions again. All you mentioned be a luxury to some others. Vaishnavi, I didn't understand your question. What is it that you were trying to say? Just write it down in more detail. Maybe I'll try to understand. I'll go back to studying in the US and working back in India. Yes, it's very much possible, as long as you don't study something called healthcare law, right? Healthcare law is another section. We had another professor who was a lawyer, purely specializing in healthcare law, that came into purely because the law in one country differs from the law in another country. But the say, for example, the portals used to put in patient data are not going to be different from one country to another. At the end of the day, US is going to have more technological advancement on using services and products, and they are going to get it back to India to use what is called the electronic health records, or EHR or EPR, one of the both names, the electronic patient record or electronic health record. That by itself is another entire industry, by the way. Just recording patient data. Why, you would ask? Because patient data is very sensitive in the US, especially in North American countries and Europe and everywhere else. Breach of patient data is considered very, very like a big, what's the right word? Oh my God, I'm phasing out on the word, criminal act, breaching patient data, because it's your personal data, right? Data is a new oil, that is true. Yeah, always was. But yeah, so you can, to answer that question, yes, you can bring that information back to India. There is also a whole, the aspect in marketing. If someone wants to get into healthcare marketing, like, you would wonder, why is there a scope in marketing? But people want to market programs, healthcare programs, hospitals, their new fancy beds, and if Kokila Ben Ambani is planning to start another 10 new hospitals somewhere in different cities back in India, they will need marketing people to get the voice out. Wouldn't the insurance requirements and emphasis on like documentation and EMRs differ between countries? Does that impact your work? I think back in India, they're still coming out with health records. It's obviously much more crazier here in the US. And, these kind of questions are very high level in the sense that they will change when your perspective will change when you come to another country. What I'm trying to say is, if you're trying to compare right now, sitting back in India, if you're trying to compare both sides of the story, it will not work out till you really come to the US, work in the US setup to understand how EHR works here and how large that company is and which all countries are using their software, which all hospitals in which country is using their software. I think that's when you'll realize whether you can transfer skill sets from one place to another.
I think my question's not that clear because like I'm phasing out on words too. I'll give you an example. So I was working in Florida, and I worked in different clinics, right? So from one clinic to another, the EMR software they use, that dictates their practice to certain extents. So
Correct.
certain clinics would stock up on, say, based on the insurance requirements, based on the type of practice they have. We were supposed to use certain tests, whether they're appropriate for the child or not. So, I mean, if it makes sense to you, we had to do the bot for everybody above 4. We had to do the P-body no matter what. And not much else. Like these are the only scales you use in a certain setting, especially something that's a high volume setting, versus like here, when you come here and if you're working with somebody who's like very data driven and like, working, practicing in based, they would ask you to pick more appropriate scales and sort of, tailor it for every single patient. So I think what my question is, is that when I was in the States, it was that we knew maybe 10 scales, but we had to use the 2 that insurance accepted, because insurance would not accept my data or the sort of references I'm getting from some other scales. Versus here, where it's, insurance is not that intrusive in your practice, and you have the freedom of picking your scales to tailor your outcome measures in a different way. So, that makes me think the time that we spent in, like we had a whole semester of when we were studying about the insurance requirements, in the States, because it's so intrusive. So, you have to tailor your practice according to that. And now I wonder, like, did I just waste that semester? Because if I've come back to India and I'm working here, what do I do with all of that information and the knowledge that I've collected from there? Because it's not applicable.
It is waste.
Yeah, so that's what I'm wondering, if that is, possibly what happens when you have a degree like yours, like healthcare administration, in a different healthcare setup. And then is that generalizable? Is that transferable? Is my question.
So my question to you is, what degree did you do in the first place when you were in Florida?
I did physical therapy. And when I went to the States, I did my master's in health sciences, and I was just working in a pediatric setup. So
Master's
it's the
in
same
health
degree, and
science.
there's still some gap.
Okay.
Yeah.
Okay, so this wasn't a health management or health administration program, right?
No.
Okay.
It's pretty much
the insurance sector is another beast, as you know now, within the US. Healthcare insurance is literally another sector that you can get into. You can do a PhD on it and your whole life will be done, and you still will not figure out what is wrong or going on in that industry. But to answer your question particularly, yes, if you do an MHA, if you do, or an MS in, because when it comes to the administration side, right, they will make you do concepts of finance, supply chain, marketing, are basic concepts of the administration process. Now, supply chain does not differ from country to country. Finances do not differ. The income statement remains the same. Balance sheet remains the same across all countries.
Right.
So there are a lot of those transferable skills when I'm saying. So if you started to work in healthcare finance and you like finance, or you like supply chain, or you like marketing, or you like coding, and you went into the IT side, you could still use those skills. But when it comes to, like I said, law and insurance, which deals with local laws country to country that differs, you will not be able to transfer those skills. There is no way. So unfortunately, yes, you would have lost out on those 6 months, but I'm sure there's ways if you can say what you learned out of those 6 months. I think the only way to put it on your resume is what you learned out of those 6 months and how it could be used to understand the insurance setup back in India. Because back in India, we run both on private and public insurance, right? Both, but majorly we deal in cash, or people have some of their insurances, but it's not like the US. It's completely different. So unfortunately, there's not much you can do out there, I think.
Right. Thank you.
Yeah, no worries. Oh, shoot. Did I shut my thing off? Oh, sorry. Still half asleep. Those are hard skills. Soft skills remain. Yeah, that's true. A lot of the hard skills are also going to be transferable. Sort of. That's what I was telling her. So if you learn finance is a hard skill. It remains transferable across countries. Doesn't matter. It depends also when you're doing that master's course, if you're trying to study something. I'm telling you, half the time people don't know what they like. We'll come back to the question. You will still finish your master's in healthcare administration and give me a call 3 years down the line. You're like, Raj, I don't know what to do. That is what I'm trying to get at. Don't get to that point. Like try to sit back and take some time to figure out what do you really like. If it is physical therapy, then what within physical therapy do you really like, right? You have to ask yourself, when people want to do masters and PhD in sports medicine or something else, they have to like what they're doing, cardiology, whatever it may be. If you don't like it, you're not going to want to do it for the rest of your life, honestly. All right, let's see more questions. Switching careers. Some people may not have practical options, even if they aren't happy with what they do. What did I miss that? How can such people make a switch? I'm trying to get the question. Some people may not be practical options.
Yeah, I think what Vaishnavi is trying to say is that switching careers may not be an option which is practical for some people. For whatever.
Tell me how. That is where I will start totally arguing. Tell me how is it not practical?
So that's somewhere where I think Vaishnavi can try to
Vaishnavi, would you want to be stuck for the rest of your working careers in a profession that you didn't like to go to every day in the morning at 9 and come back at 5 in the evening? I don't think you want to be doing that.
I think I should have added asking for a friend in the end, because really this is because what I'm trying to ask, I'm extremely happy with what I'm doing right now. But
yes,
I want to know that I'm very happy doing, and I might even consider studying more of what I'm doing. So no, I want to know, like, some people realize after they have invested a substantial amount of money into a career that they don't really want to pursue, and maybe they have debts, or they have to pay back loans, or they.
You know how much loans I had? My US education cost me $75,000. That is close around 50 lakhs.
Yeah. So then what can they do in this situation? I mean, you gathered the courage, you mustered the courage to switch it. But for them, it might seem like a Herculean task. So is it just like an attitude change that would make a difference and everything falls into place? Or they have to be pragmatic about it, weigh the pros and cons, maybe stay doing what they're doing?
Yes. You have to be practical. Like I said, if somebody wants to switch, okay, for example, and they don't have the option to come to US or Canada or study somewhere abroad and do some fancy ass degree that's costing 50 lakhs, no, you don't have to do that. Just that there are options to do those things back in India. You could still study within India, master's programs, like I said, at Tata or somewhere else, that are reputable kind of institutions within the spectrum of even being in Bombay, and don't even have to get out. And you could still finish that. And you have hundreds of hospitals now, even literally in the city, that will take you to their the administration side immediately. So yes, you have to be practical to think about money, time, investment. But at the end of the day, I also think just because I have invested 4 years of my life doing physical therapy, do I see myself putting the rest 30, 40 years behind physiotherapy just because I spent the first 4 years? Not really.
Yeah, like, yes, see, right. Saurabh is just saying non-supportive parents and finance.
Ah, these are
Right.
usual problems of a life. Or the parents are just not supportive. One career option we can go about. So I'm trying to read. Just give me 1 second. Yeah, one career option we can go about where we can explore about healthcare systems and how we can reach more masses and make healthcare more nominal. Bankam Tanvi's points. Finance and non-supportive parents. Okay, so is that the biggest problem though? You're saying that parents are not supportive enough to let you leave physical therapy.
Yeah, see, yeah, in some cases that could be an issue.
I will also give you an example of something that happened 2 days before I was literally about to fly out. One of my juniors was talking to me like this, right, on the phone, and be like, Raj, my dad is not letting me go abroad. Can you talk to him? And there's literally 2 days left for me to pack and leave. And she said, can you please take out time? And I said, sure. And her father came over to my place and we had a discussion straight up. And I spoke to him. I said, I totally understand. I said, let's talk about practical situations, right? You're a father of a girl back in India, so you do have more reservations than if it was a boy. That was number one. It was like, how can I send my daughter abroad? She is single. I'm scared as a father, blah, blah, blah. What is going to happen? I said, you can't even decide what is going to happen when she sits here. How are you controlling her life when she's going to go somewhere else abroad or to do something else? I think at the end of the day, your parents will be supportive if you tell them you don't like what you're doing. I think we make half the shit up in our head, honestly. Our parents just want the best for us. They want us to be happy. You know, when they keep on saying, beta, jo bhi karo, do it so that you stay happy at the end of the day. And you have to muster up that courage to move out of your field, even if you did it for the last 3 or 4 years. There is no other way out. Or you will just see yourself sit and rot, you know, doing whatever you're doing and just be bad at it. I'd rather you be a decent healthcare administrator than a poor physical therapist.
I think a lot of it comes from also the way our education system in the country is, because
Let's not even get started on that. It is
because
very
we're in 12th and then we have to make a decision right away. You think that could be a reason because we're really young?
I was just telling that. I was just telling that to OS. Still I'm dumb, right? So I used to consider myself dumb, even all the way when I made the decision to get into physical therapy. I did not have the social or mental skills to think that this was a right or a wrong decision. So I think personally, we don't mature mentally. Even after we get into grad school, we're still deciding like, oh, what the hell do I want to do? I don't know if this is right or wrong. So see, we can't get to changing our education system right now in one Zoom phone call. So we have to deal with what we have at this point.
Yeah. So then that is what I'm trying to say. How do we make good decisions at that age? Because our system doesn't permit us. So how do we even prevent ourselves from getting into that position where we don't want to be confused? Like, how do we be sure of what we are like going to embark upon?
That is much more of a detailed question than I would even have the knowledge to answer. Yeah, to be honest, I do not have the knowledge to answer, because what you're trying to ask is, how do we get all these people who are currently in their 12th standard to make the right decision to get into...
Not all of them.
You know what I'm saying?
Not all of them. Yeah. I mean, why should we even land ourselves into that position to like make a switch? Because that can be... Don't you think if you would have probably not...
I should have started a bachelor's in the MBA, or what we call it, we have in India. BBA. Yeah. Yes. I should have ideally started BBA. But guess what? I didn't know about BBA because I come from a healthcare background. My family is drenched in healthcare since day one. So it's like, oh, what's the next best thing that you could do? You should get into something healthcare related field, right? Blah, blah, blah. But then at the end of the day, I would ask myself, does this make me happy? And it never did. So then I moved. Again, coming back to this only very basic question nowadays, I'll switch back to like life questions from physical therapy questions. I have started to ask myself that question every single day. in every single thing that I've been doing. Does this make me happy? Does meeting this friend make me happy? Does going out make me happy? Does staying at home make me happy? And if
That's
the
very
answer
Mary
yes,
Kondo of you.
I have been doing
Yes.
Marie Kondo with my whole freaking life. I have been doing Marie Kondo with my whole life at this point. To a point when I go to the market to buy things,
I was just about to ask if it is applicable to the grocery.
I'm telling you, this is not mine that I'm wearing right now. It belongs to a friend.
But it
Because
makes
I was like, to needs and wants, right? Needs and wants are extremely, extremely important. Sort of, stop it. Needs and wants are very important thing. Also, let me go back. I think I missed out a lot of questions here. I'm trying to see. Hold on. Whole different conversation. Okay, that's fine. Biggest fight is one we have with ourselves. Yep, that is true. Very counter, blah, blah, blah. Nerd point. Always. Good God. Supposed to make life decisions at 18 to 20. That is so true. That's where I come back. I commend people like always, for example, on this chat, right? He knows what he at least wants to do with physical therapy, or whether that's PhD. And I'll tell you, some people have the capability of knowing what they want to do in career choices and life choices. Some people don't. Take my example. I don't have the idea. It took me a while. Okay, I'm 32 right now. It took me a while to get to a point when I was 27, 28 to ask myself, is this really what I want to do for the rest of my life? Ask yourself that question. What do you want to do? Do you see yourself sitting on a desk? Or some of my friends who would say, I don't see myself picking somebody's leg and putting it up and down 10 times a day for the rest of my life. So if you don't see yourself doing that, then you're in the wrong profession. You need to get out and do something else. I'm hoping I'm still answering people's questions that are making sense. There's a lot of people on here oh my God.
Yeah,
All right.
I think Sai had a question. I think what he was trying to get at is like a career option in which you can actually explore the healthcare industry in general and try to make healthcare more equitable so that you can go and reach the masses. I don't know of any one particular healthcare career which offers that other than public health, but I would not be the best person to ask about that. Maybe Raj, can you offer some insight into how to explore the healthcare industry in general and try to make healthcare more equitable?
I would actually ask you to do a small internship somewhere if you can. Even if it's going on the weekends, like find a local hospital or something that has the administration factor in there. And if you're currently in a third and a fourth year and you can't go every day, I'm not telling you to make time to go every day. Even go on a Saturday or a Sunday and do like 4 times a month. Even if you just go on a Saturday and find out what they do and where they're getting their health record systems from. Because I'm sure they're keeping something, right? There's some track of somebody's working on finances, somebody's working in accounting, somebody's working in supply chain, somebody's working in sourcing the hospital beds from somewhere, somebody's paying the bills of the hospital. There are people doing literally 10,000 jobs inside the hospital. So I think the only way is to figure out doing this. And I think I'll come back to this person's question. There is no one career option. I think that's what I want to tell you. In healthcare, when you think about healthcare, think of it literally as an industry.
Okay.
When you think of it as the industry, think of every smaller silo that comes to your head that works inside. Like, for example, right, if you take the food industry, within the food industry, there are companies that purely cater to making food just for the planes, so tiny plates with tiny portions. And that food should be completely edible at 30,000 feet, within the air. It's that kind of a situation. If you think about healthcare as that kind of a large industry, think about everything that you can do, even making food for hospitals, right? If you like making food, if your thing is, I love making food is my life, healthcare is my life, you could combine the two and start a freaking company where you're selling health bars and you're selling some new protein drink or some shake somewhere. I don't know. Right, the options are endless when you think about it, really. Okay, but they're saying public health will be a completely different ballgame. I feel healthcare administration focuses more on the management side of resources. Public health may or may not include finance and economics part of it. Absolutely. So I do have a friend, if y'all are highly interested, those, after this conversation, that are really, really thinking of switching fields, you can reach out to me and I can make you get in contact with my classmate who finished her MPA from Tata, who's working on the epidemiology side of things. But I'll tell you, sometimes when I've seen her do the epidemiology side of things, what they're trying to do is they're trying to get resources to go to rural setups to make people really understand how and where diseases are spreading, how you can stop them. So it will also involve a lot of economics per se. Not a lot, but you get my point. Like, if you become a head of that program, then you're trying to source people, product, you're trying to source people's flights, you're trying to source everything from people going one part of the country to another, because a lot of them are working on national programs, the ones that the prime minister or the health ministry comes out with, polio eradication, all of these programs that you hear, they're all part of that whole process. So at some point you will be handling low level stuff to a point where you have to handle finances for that program.
Raj, Sai here. Can I ask a question?
Oh, please go ahead.
Yeah. So about the thing which you just explained right now about the epidemiology. So what exactly is the the course name? Like, what
I
exactly
think
is the
it's called Masters in Public Health, if I'm not mistaken. MPH or MPA is the name of the program. And this one is, I think the one that she did is in Tata. I don't know the name of the program exactly, but I know for sure she did it from Tata.
Okay. And also, I had one more doubt about the question which I asked you. I wanted to know exactly like how outreach projects happen in different countries. Like they go and adopt different like they just set up an organization like how WHO and UNICEF works. So like how do they come up with all these strategies and stuff? Like is there anything specific they learn? And if there are any courses related to it, then I will like to know.
Again, I, for example, worked at a place called the American, oh my God, I worked at the American Heart Association or the Hospital Association. It was some internship I had done like eons ago. Now I can't remember exactly. And I think it was the American Hospital Association, and it was a not-for-profit organization. Everybody who worked there had never done a MPH, MHA program, nothing, right? All their goal was to increase fundraising goals for the AHA Mother Association that was sitting somewhere within the US. So they had money coming in from donors, they had money coming in from the local government, they had money coming in from private and public setup both. And all their job was to come up with community programs and come up with corporate, those fun runs, 200-meter run, 500-meter run, whatever it is, those fun runs, and raise money for these events. Now, if you ask me what courses they did in the school, I'm sure they did some kind of an undergrad course because they were local Americans. There were not a lot of people from abroad that were studying out there. But unfortunately, we don't have that privilege. So it comes down to, again, you have to do some course, some master's course or something to get your foot, into the US. If that is your idea, if the idea is to stay back in India, then I think you could still pursue another master's course and get into something that you like. That, like I'm saying, that is each and every association that you can think of, Blind Foundation of India to the Indian Cancer Society or Heart Association or whatever it may be, they all need people to manage their side of things, whether it's their finances, their supply chain, their whatever it may be, their programs, right? So people get into program and the event management side in healthcare especially. So how and which kind of physicians do you call to give these lectures and series and things like that? And I'm sure there's a whole other kind of aspect and industry in there that I have absolutely no idea about how it works. Wow, I've been shutting off my video for no reason. Sorry.
Thank you, Raj. I think my doubt got cleared. Thank you so much.
Yeah. And if you have questions, like I said, reach out to me on Facebook, Instagram, wherever there is, and you can still ask me questions one-on-one. I'm totally up for it.
Yeah, I'll surely do that. Thank you so much.
Sure. No issues. Interest from this and you. Yes. Vaishnavi, you're right. WHO does have internships. I did check that. I think at one point in time, WHO has internships. UNICEF has internships. The United Nations has internships. Bill and Melinda Gates Foundation, if you'll look into that, they work a lot even back in India, because obviously we're considered a developing nation. We have a lot of things to take care of still. So they give a lot of grants. So people only work on, there's even Barack Obama Foundation. People also work on just grant, just to get, like there's a whole kind of industry where people only work to understand how to get money from other people to use for healthcare. That's all their job is, just to get grants and just to get them approved from one person to another. Okay. What is Shreya asking? Is there a healthcare field or career option where one could combine administration and physiotherapy? Absolutely. That is a golden question you asked. There is 100%, so many chances. So in a bunch of these physiotherapy clinics across the US, right, you have local administrators that after maybe years of 2 or 3 years, you know how you grow in a field from junior executive to manager to senior manager to director. There is a similar growth even for physiotherapists, right? If you're working in a physiotherapy clinic and say there are 5 physiotherapists, there are 10 physiotherapists, so you're working in a large setup in a hospital where there are 50 physiotherapists, then suddenly you will have a team lead. Then after the team lead, you will have a manager. Now the manager's job is to take care of not just dealing with patients or dealing with problems that come across with one of those 50 people, but dealing with finances for those 50 people, dealing with supplies that are required to get for the department. So where do I source my new cervical traction machine, whether it's cheaper in this place or it's cheaper in, in another place. We have too many patients coming in for PID, but I need new beds, but I need specific kind of beds, but the option to pay for this bed is for $5,000. The option to pay for this bed is $1,000. So I have to weigh and tell my director and my vice presidents of my hospital why I need $50,000 to buy 10 beds and why these 10 beds, which will only cost $10,000, are going to be useless and patients are not going to benefit. So coming back to that question, whether you can combine both of those knowledge aspects, yes, you can. Depends where you get your job, in which particular physiotherapy setup, how big is that setup, right? And how much you can, and how much do you want to grow in it? Take the example of your one of your passed out people, right? Whether it is Unnati ma'am or whether it is Yardi or whoever it is, right? They were also students at one point of time. Then they became physical therapists. Then they became professors. Then they became head of departments. Then they'll do whatever they want to do next. All right. What's the next best thing that you're looking forward to in life, personally and professionally? Oh, yes, because we're getting to a close. Well, next best thing, personally and professionally, I actually want to work on a startup by the end of this year. My go-to forte is now become mental health. Mental health is where I want to be because that's what I love to do every single day of my life. So I'm hoping to figure out in this crisis who is going to give money to my startup, which is going to be another headache. But we'll figure it out. But the life goal is almost set to this point. Life goal is to do whatever I want and just be happy doing it. It doesn't have to be big. I don't have to make millions. I just have to learn to be happy. That's it. It's really that simple. And Saurabh, you know that already. So that is a great question. Does anybody have any other burning questions right now that I can answer? Who wants to unmute their mics and go for it? Shreya and something. Specific course? No. Oh my God, where did I miss the questions? Is there a specific course for administrative job after BPT? The specific course is the one that I was telling you, which is in Tata, but there are schools outside of Tata that do the same thing. It's called Masters in Health Administration, MHA, or Masters in Health Service Administration. Outside of Masters, I'm not sure if there are other diploma or some other smaller certification courses. Tanvi says, I'm so inspired to drop everything and start a winery after this talk. I think you should absolutely do it. Tell me why one should not do it.
Because she'll probably drink all the wine.
Huh?
Probably they don't have the land for growing all those grapes.
And you will get land also, don't worry. I'm telling you, it's very easy. People when go and do an internship at Sula, somewhere in Nasik, I don't know where that is. I heard it's really good, but I haven't been there yet.
Yeah, I actually found out about like a lot of these courses, you know, there are these like 3-level wine exams, like they've intellectualized wine to like a whole other point. It's very interesting.
Do what you love. I'm telling you, if you like to do that, do it. I would tell you do it. Don't wait for people to tell you. The log kya sochegi, dunya kya sochenge situation. If you are going to sit and do that, you are going to be extremely unhappy, and you will realize it, if not now, at some point in your life, and you will want to switch, and you will look back and just do me one favor and never look back in regret, saying that I should have done this at this point when I had the opportunity, or when I had, you know, if you're fortunate enough to have the money, to have resources, to have people, and to have the option to do something, do it. Don't even wait for it. Okay, now they've gone to a whole separate section on winery. We're terrible spitter.
So for others who have joined, right? Like the funniest thing was I only knew a few people from who were like our seniors that we kept in touch with, and I think 2009, Raj, when you left college, we had just joined. Like I was in the first year, and you were finishing your internship at that time. And after 2009, I think after 10 years, last year I met Raj in Indonesia, and that was crazy, right? Completely unexpected. And that's when I got to know that like you're one person who's doing this really crazy things in your life right now. And there's another senior of mine who was just like my immediate senior, Taruna. She became a bartender on a cruise after finishing her master's in.
I heard.
Like you just have to look, right? Like there are these people doing crazy things in life, and
do what you love. And you know, at the end of the day, I go back to the same statement. You know, it's as stupid as it sounds, and it used to sound dumb even when somebody said it back in India when I'd asked them. And I remember, Saurabh, you had this question once. I remember in frustration. I still remember you had posted that question in frustration when it came to finances, and when it came to really understanding, when people in US were saying my life is difficult versus somebody back in India saying my life is difficult. And I remember you said, don't compare these two. And I'll tell you, I still sat back to that statement, and I sat and I had tried to psychoanalyze as to if I were sitting back in your position back in India with the things that you've gone through and the experiences you've had, how would I have thought of it differently, and whether your set of the argument made sense. And I'll tell you, even your set of the argument did make sense. If somebody is sitting back in the US and making $100,000 a year and has more money and can travel the world and do something else, they have the option of speaking more about their experiences. But then the question comes up, like you said in one of this chat, someone said, what if I don't have the financial support, or what if I don't have the parental support to do something? I've also said in the past, and I've said, I've come myself with loans, right? It is possible to pay off loans. It is possible to get out to get the education within India or abroad. It doesn't matter. At the end of the day, you have to have the balls to get out, and don't regret that decision of staying where you are. That's all I'm going to tell people, because I think it's just not going to make you happy. Renita says she met somebody in Meghalaya who was the MD of a petroleum company and left everything just to live the minimalist lifestyle in Shillong. Yep, pretty much that's that. You just nailed it right there. You know, I have asked myself so many times of what did I want to be happy, right, with me? Needs versus wants. Did I want new clothes? Did I want a new shoe? Did I want a new phone? Did I want a new Xbox? I want a lot of things. But do I need a lot of things? The answer always came back is no, I don't need it. When I used to tell people, they're like, how did you manage to travel the world? What number one question for traveling the world used to come up with, how much did you spend? Tere paas itna paisa kahan se hai? Tu to pehle se bahut ameer hoga. I'm telling you, if I have had a penny for every time I've heard these statements, I would be a millionaire by now. Every second person they're like, acha teko kaam nahi hai kya? Tu chhod ke you're just going out and traveling the world. You don't have any sense of responsibility. You don't have to send money back to your parents back in India. So half these people don't even know. My father is 79, and 80 years old. He doesn't have more than maybe 5-6 years left to him, right? So there's a lot of things that I have to think in my head when I'm even living my life every day, technically. But yes, I personally know, and even myself, there are people outside who've gone with loans, who've gone, you know, you have to make it, you have to want it desperately. At the end of the day, I think you'll realize if you want something desperately, you will find out ways and options out there to do it. You will find out and research universities that will give you scholarships. So in my university, just like when I was back in DY, and I became general secretary and whatever, and I was doing these extracurricular cultural activities, I had to do that even back in the US. And when I did that within my university, the deans, blah, 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 saw what I was doing. And then I had to apply for grants, and I had to apply for loan waivers, and I got through those. So my fee for my school was made into half for the second year, for the whole second year. So in the second year, I took the advantage because the fee was half. That is when I took the second master's course and finished the MBA. So I really finished. If I would have paid full price for the MBA and the master's, I would have ended up spending like $130,000 or something, some ridiculous amount. And everything was just made into half of that. So I may have ranted on a little longer. Share the craziest story from your travels in the past year. Oh my God, there's not one. Oh, good God. Shoot, there is literally not one.
Craziest is always one, right? Craziest.
No, there is. Oh, craziest was, so I don't know to swim. And in Vietnam, when we went, also, you're welcome. Somebody just said something on the chat group. Vaishnavi. Yeah, sure. No problem. So in Vietnam, when I went, we went for trekking down the waterfalls. What was it called? Rappelling or something else? I don't know. I don't know to swim. So there were 6 of us that went in a group, and they brought us to a point where there was a 10-meter drop. Yeah, waterfall rappelling, something like that. I don't know. It's called something else. They had labeled it something else over there. And when they brought me to the 10-meter fall, I had a jacket on, and you know, all my friends are just like standing there. You know how you go and you buy something from a store and you eat? They're just standing there like, okay, now go jump. And I'm just looking at them. They're like, one person starts jumping, second person starts jumping, and then I just went and jumped right then and there, not even realizing what I'm doing. There were so many times that I was so close to the rocks that I would have almost hit my head and die. But I was like, hey, it's one life, you got to live it. So I think that by far is when I had my balls in my mouth. There's lots of times, there are times people have tried to steal my passport, they've tried to steal my money and cards. People have stopped me in the middle of the streets trying to take your attention away in certain parts of the world. If you go, that actually does happen. Jump without a life jacket, nearly drowned. Yeah, please don't do that. The funny part is I love to swim and I cannot swim. So even when I went to Greece, we got drunk on a party boat in Greece, absolutely pissed drunk, okay? Because the alcohol is unlimited on the boats and they're just young people out there. And then you're on a party boat, okay? During the daytime, and you're supposed to jump into the water half drunk. So thankfully I had my jacket on, but they would not let me jump from the second floor because they're like, you die. Greece is the Goa of Europe. That is so true. Greece is the Goa of Europe. And you know the interesting part? There was a place that we stayed at in Mykonos, right beside Lindsay Lohan and their beach clubs. So obviously we, right, poor Garib Indian was staying at $20 a night hostel, where literally in a room, it felt like you were in a military bunker, where there are like 10 beds right beside each other, just one lined up beds, and then small things to put your stuff in on the side. You literally came to the room just to sleep and get out. And right beside where we were, there was a beach club right next to us. And when we went to the beach club to see the sunset, they asked us, do you want to book a table here? And then I asked them, how much was the table for? And he said it was for 5,000 euros an evening to book a table by the sunset. I was just like, okay, peace out. Thank you. We're going back to our $20 hostel, which had the same view, by the way, which had the exact same view of both these places. But you got to figure out, how you're going to go about doing all this. And I could have even spent much less than I did. I don't know if people are interested, but I'll give you all a quick update. How many people do we have still on the call? And if people are getting late, they can absolutely let me know. Oh yeah, travel hacks. I was just getting down to all the travel hacks. Oh, I should do a separate travel hacks webinar, right? Just for traveling. Absolutely. People were like, how did you manage? How? I said, I did 3 months of Europe, 3 months, Spain, Italy, Greece, and France for 5,000 US, which in current conversion is 3.5 lakhs. Beat that. 3 whole months in Europe, which included all flights, flight insurance, going to Rome, Vatican, the entry fee to every hostel everywhere. You can try to imagine. I did Rome, Naples, business degree paid off. Okay, I actually have a running spreadsheet of every single day, 365 days, by column, split out into how much was spent on food, how much was spent on alcohol, how much was spent on the accessories and shopping, how much was spent on, which I didn't shop anything, but there's a whole column on how much was spent on, Jesus, sort of good jeans. Luxury is expensive. Traveling is cheap. Traveling actually can be cheap. Don't even get me started. I'm telling you, we should hold a separate seminar on traveling, and I can only talk about travel and non-physiotherapy things. Of how I met somebody in Europe who was traveling 6 months in Europe while doing work exchanges on $2,000, and people were like, "Wait, 6 months in Europe on $2,000?" I said, "Yes, 6 months in Europe for $1.5 lakh is possible. If somebody can do it, you can't tell me that somebody can't do it, because I physically met somebody who was on their 6 month finishing that travel." So it's definitely possible, because I get that question a lot where people are like, I don't have the money. How do I travel? I said, I did not go shopping or buy new clothes for 1.5 years. I would meal prep every single day at home. I've had the same food on Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, lunch, breakfast, dinner. Exact same thing. I've actually frozen food, put it in the freezer, had the same thing after 6 and 7 days. So if you are ready to do your sacrifices, you can get out. It's absolutely possible. You just have to weigh your needs and wants. That's it. If your want is to travel the world, then you have to make it happen. All right, I know we may have completely overrun our time, have we? It's 10:13 here. I don't know. What is the time back in India right now? What is the time back in India, guys? 10:45. Okay. I can close this webinar whenever y'all want to. Who wants to continue to listen? At least let me know. Then I can go on ranting more, because I don't want to keep everybody waiting.
So maybe what we can do is we can probably stop the recording.
Yep.
And we can just continue the webinar.
Yep. That's fine. Then I can give you juicy details.
That's what I'm looking for, yeah.